welcome to this session. It's a pleasure for me to share this session, which is about research to policy. And we think that this is the heart of what we are supposed to do in IPORA, so research to policy. Indeed, everyone agrees that research should inform policy, but in practice, the link between research and policy is not so easy to establish. And why? And one of the points is that research, and policy makers have sometimes different patterns. And often they don't speak the same language. And also, evidence may come late, sometimes in the wrong format, and may not be relevant. And beyond the evidence itself, a relationship of trust between researchers and policymakers is something very important, because translation of research findings into policy decisions takes years to build. And this morning, this panel brings together 3 speakers who will share with us their own experiences. And let me introduce those speakers. And the first speaker is Gashaw Abate. I hope I pronounce very well his name. Okay. So Abate is a research fellow at IFPRI, International Food Policy Research Institute in Washington, D.C. And the research spans agricultural technology adoption, impact evaluation, and food policy in Ethiopia, from cooperative institutions and food productivity to the geography of public service delivery. And the topic he will talk about is training and engaging current and future leaders to improve evidence used in policy making. And he's already online. And we have 20 minutes, about 20 minutes to deliver his presentation. So, Mr. Abate, the floor is yours. Thank you.
Great, thank you. Can you hear me properly?
Yes. Yes,
Great.
yes.
Great. Good morning, all. My name is Gashaw Abate. I work for IFPRI, the International Food Policy Research Institute. So, first of all, I'm really sorry I couldn't join in person because of other overlapping engagements. I'm training survey enumerators for an upcoming in-the-line survey here in Addis. Yeah, thank you for the opportunity to present our planned study virtually. Current and future leaders to improve evidence used in policy making in Ethiopia. This is a collaborative research project by 3 organizations, IFPRI, APLEX, the African Leadership Excellence Academy, and PSI, the Policy Studies Institute. To start with a brief background, our planned study is a part of a large research program on evidence-informed policymaking in Sub-Saharan Africa and South Asia. This is a research program supported by FCDO and managed by FCDO's Research Commissioning Center at 3I. So the research program has 3 strands of research. Under strand 1, it focused on developing conceptual framework and measurement inventories related to evidence-informed policy decision. So this component is already conducted by RCC, and then they have developed a comprehensive conceptual framework as well as a rich measurements and indicators related to evidence-informed policy making, as well as some supportive guideline that can be used to track and assess evidence used in policy decision making. So I will encourage you all to look at these resources if you are interested in this topic, in evidence-informed policy decision making. The strand 2 of the research program focus on studies of evidence use in practice. These are kind of retrospective research that look at evidence use in existing policies and strategies. And the program commissioned about 8 studies, and one of the study is led by IFPRI, where we look at the evidence used in the design of the agricultural commercialization cluster in Ethiopia, as well as in the design of the block farming initiative in Malawi, with the aim of conducting a cross-country comparative analysis in evidence used in existing policies and strategies. The strand 3 focus on interventions that can influence use of evidence in policy making, with the objective of kind of advancing empirical knowledge on how to improve the use of evidence in policy making through rigorous evaluation. So the program commissioned about 9 studies, and then the planned study I'm going to present today is one of the 9 studies that's part of the strand 3. Work or planned study is despite growing recognition and increased production of research-based evidence in low and middle-income countries, studies indicates that the use of research-based evidence in policy decision-making is very limited. Especially across sub-Saharan Africa, evidence ecosystem face key constraints related to the demand side as well as the supply side of research-based evidence. On the supply side, there is limited availability of accessible evidence, especially in a format that is friendly to policymakers. But there are also concerns on the availability of policy-relevant research-based evidence. On the demand side, there is low awareness and limited trust, as well as weak capacity to interpret evidence. And in most cases, there's also insufficient political commitment to use research-based evidence in policy decision makings. And these challenges are also reinforced by complex political and institutional context, which further constrain effective use of research-based evidence in policy decision. Even in the context where the supply and demand of research-based evidence is relatively better, the impact of evidence on policy decisions remain unclear, and it's also difficult to measure. So Ethiopia as a country kind of illustrates this gap, if you want, the tension between growing investment in evidence generation and the realities of policy making, which is largely shaped by political economy dynamics. Despite 3 decades of investment in strengthening research capacity in universities, in research institutions, both the production and use of research-based evidence is reportedly limited. For instance, successive governments in Ethiopia emphasize evidence-informed policy decision-making, but there are also studies that suggest elite priorities and then political economy consideration continue to dominate final decisions when it comes to policy making. So addressing these barriers require testing innovative interventions that can simultaneously tackle both supply and demand side constraints, and that's what we're trying to do with this planned study. So we are proposing 2 closely related interventions that are designed to promote the effective and timely use of research-based evidence aimed at addressing the demand side constraints through capacity building and training intervention that are designed to strengthen policymakers' awareness about research-based evidence, as well as also improve their ability to commission, fund research, interpret, and effectively use such evidence when it becomes available. So these components of the study will be implemented in collaboration with the African Leadership Excellence Academy. And this component closely align also with the mandate of APLEX, which is essentially training current and future policymakers. So the second intervention aims to address the supply side constraints, and it involves establishing an evidence translation and intermediation service, specifically equipped with rapid response capabilities that will provide policymakers with on-demand synthesis of research relevant to their current area of work. And this component will be implemented in collaboration with the Policy Studies Institute, which is a premier government policy think tank in Ethiopia. And these components of the intervention also closely align with the core mandate of PSI. So we're considering the continuity or sustainability of these interventions when we decide to collaborate both with APLEX and PSI. So we plan to address about 4 research questions. We're very ambitious with this research project. First, we want to understand whether capacity building and training interventions can significantly increase policymakers' demand for and use of research evidence in policy decision. Second, we want to understand whether providing evidence in a user-friendly format through evidence translation and intermediation service can significantly increase the trust, confidence, and use of evidence in policy formulation by policymakers. Besides these 2 primary research questions, we want to also understand what attributes of research evidence do policymakers prioritize, and how do these preferences influence evidence uptake? For instance, we plan to look at whether preference related to the accessibility of evidence in the form of summary or in the form of policy note or policy brief versus for full reports, their preference regarding the timeliness of evidence in relation to the policy process, but also their preference related to the type or source of evidence, whether they prefer evidence that is generated by public research institution versus independent research institution. We want to also look at what contextual factors affect the use of research evidence by policymakers, specifically institutional arrangement, policymakers' characteristics, or policymakers' baseline belief related to research-based evidence, and organizational structure as well as process, whether these factors kind of affect the use of research-based evidence by policymakers. So we're targeting about 360 high-level policymakers at the directorate level in federal ministries that are engaged in nationally significant economic policies, such as related to agriculture, industry, trade, energy, transport, labor, and skills, among others. And then we're planning to assign these 360 high-level policymakers into 3 study arms, including the control group, where we provide the standard APLEX leadership training program, and the treatment 1 group that will receive training on research-based evidence for policymaking on top of the APLEX standard leadership training, and a treatment 2 that will receive evidence synthesis on their current main areas of work on top of the training on research-based evidence and the APLEX standard leadership training program. So the training will be provided, as I mentioned, in APLEX, in the Africa Leadership Excellence Academy. So we're planning to invite experts on the area of research-based evidence in policy decision, inviting experts from the institutions like from Addis Ababa University, from research institutions, from IFPRI, and other experts to come and provide this training on research-based evidence for policy making. We plan to look at 4 sets of key outcomes. The first one is related to conceptual outcome. After the intervention, we will assess policymakers' perception of the value of evidence, as well as their ability to frame policy issues and define policy problems, their understanding of theory of change or result frameworks, but also their willingness to pay for evidence and their trust and confidence in research-based evidence. We'll also look at behavioral outcomes related to demand for research evidence, whether policymakers after the intervention start engaging or collaborating with researchers, whether they start to use data platforms or evidence repositories, and also if they make any reference to evidence in recent policy processes. So besides we're looking at these conceptual and behavioral outcomes because policymakers may not get a policy-making window during the study periods. But besides conceptual and behavioral outcome, we'll also look at outcomes related to process and procedures. For instance, if policymakers establish processes for the creation and evaluation of policy options or alternatives, whether they start partnering with research institutes and universities. And lastly, we'll look at if policymakers after the intervention concretely use evidence in the development of new policies, legislations, plans, as well as also in the revision of existing policy documents, and also if they use research-based evidence while making decisions in resource allocations. So I will stop here for today because this is a study we just started in February. Hopefully, in the next IPORA assembly, will come with preliminary result from this study. Once again, thank you very much for the opportunity to join you this morning. Over to you.
Okay, thank you, Mr. Abate, for your presentation about the relationship between research evidence and policy decision making. So after you, I think the second speaker will be the second speaker for this session will be Chishala Chabala. And let us introduce the second speaker. So Chishala will discuss how research on public health intervention has fed into policy in Zambia and at international level. So who is Chishala Chabala? Chishala Chabala is the lecturer and consultant pediatrician at the University of Zambia, at School of Medicine and the University Teaching Hospital, where he teaches, conducts research and provides clinical care. And he is a current vice chair of the Child and Adolescent TB Working Group of the WHO. And the title of the presentation of Chishala will be Integrating Research into Policy and Practice for Improved Care of Children with TB. So Chishala will also have about 20 minutes to deliver his presentation. So thank you.
Thank you very much for this opportunity to share some of the work that we are doing TB and how we're translating that into policy. While my slides are loading, so this presentation was prepared by myself and Joanna, who's seated right in front of me. And so I will be sharing our ideas that we both looked at. So I will be talking to you about the experiences that we've had in changing research findings into practice. And I'll give you two examples of some of the work that we did as an example. Next slide.
Next, yeah.
Okay, so I'll give you two examples of these. One was his experience, which was based on research that was generated in Zambia and other countries that then influenced global policy on the care of children with regards to shortening tuberculosis treatment in children. And then I'll give you another example of a global recommendation that was made at the level of the World Health Organization, and how now that is being contextualized to research policy in Zambia. I think just to remind you about TB, I think Joanna spoke to this on Tuesday, but TB is the leading infectious disease killer in the world, and it affects nearly 1 million children, and a quarter of those die from it, and they died chiefly because they were not identified and they were not treated. And there are lots of gaps globally in the identification of people with TB. And if you look at the graph below, you will notice that children are less likely to be identified with TB compared to adults. And within the population of children who are younger than 5 years are likely to be not identified when they have TB. And there are several challenges in the identification as well as in the treatment of children that the examples of the policy integration we're going to speak about addressing. First of all, in terms of identifying children with TB, it's a challenge because normally when an individual has TB, like an adult has TB, there's an elaborate process now you identify their symptoms. When the healthcare provider assesses them, they order sputum tests and just X-rays, and based on these parameters, they're able to identify quickly the individual's TB. But that's not the case in children, because the tests that we normally use to identify TB are less sensitive in children. And then it's also getting a sample from a child is much more difficult. Imagine asking a 1-year-old to give you a sputum sample. It's very impossible, so you have to use those sorts of things to get that sample. And then when you do just radiography, even when you do just radiography, the pattern of disease is very different in children. And then within the health system itself, there are lots of diagnostic constraints that, because of the complexity of identifying TB in a child, most health facilities are not able or do not have the capacity to identify a child with TB. When the child is identified with TB, they need to be treated. Sometimes they don't have the medicines are not designed for children. They are originally designed for adults. So if you don't have specifically made medicine that you administer to children, and then you face the challenge when treating the children. And then the TB treatments are very long, 6 months for some forms, 12 months for other forms. And this means then that the care provider needs to make multiple visits to a health facility to have the child cared for. And then in settings where TB is common, it often occurs with HIV infection in the context of poverty. Therefore, you have to treat the TB, treat the HIV, and all the other complications that come with that. So this is where the research on treatment shortening can I'll just take you through what treatment shortening is. Like I mentioned that the current existing treatments for TB were designed for adults. And then it's then assumed that a child is a scaled down model of an adult. So if an adult needs 3 tablets, a bigger child needs maybe something equivalent to an adult. A child in the middle, 2 quarter, an adult, a smaller child, 1/3, something like that. So it's very much derived from adults. And this approach, ignores the fact that disease in children manifests very differently from disease in adults because of the unique physiological makeup of children. And even when they're dosing and treating the child, the doses and duration may not be necessarily the same between adults and children, even though the treatment at the time that research was being done was 6 months for lung disease, 12 months extrapulmonary severe forms of disease. However, we know that when children have TB, the majority of them have a mild form of TB, which is referred as a non-severe form of TB. And therefore, there's a possibility that this sort of TB can be shortened. And if you shorten this treatment, then you make treatment easier, you reduce medical costs, and you reduce the time that they're exposed to the treatment and therefore fewer side effects. So this is where the SHINE trial came in. So the SHINE trial was a randomized controlled clinical trial that asked this question: can TB treatment be shortened safely from 4 to 6 weeks in children with non-severe TB? And so this trial was conducted between 2016 and 2020. And it was a trial that enrolled children who had TB, and then they were randomized to receive the standard 6 months treatment or the shortened 4-month treatment. And then they were followed up to see if the groups of children that had unfavorable children not between the 2 groups. And this was conducted in Zambia, Uganda, South Africa, and India. And the main finding was that when you look at the unfavorable outcomes between those children who received 4 months and those who received the 6 months treatment, there actually was no difference. And in terms of undesirable effects, difference. And so this trial concluded that 4 months treatment was as good as 6 months treatment, and it was published in 2022. And so for those of you who may not be from the health sector, that the World Health Organization actually is the key policymaker for healthcare. And it reviews evidence that are produced globally to support different health interventions. And so they look at all the evidence that has been generated from research, and they go through a very rigorous process of reviewing the evidence, questions, synthesizing the evidence, and then they bring in a group of experts that then looks at evidence and makes recommendations. So the findings of this trial went through this process, and the WHO in 2022 then updated their treatment based on this trial and recommended 4 months for children with non-severe TB. And along with that, they provided even implementation guidance to national programs around they can go about it, and provided tools that were to be used, and some of them were derived from this trial. And once the WHO makes the recommendations, then this recommendation goes to health ministries, who then formulates national programs and then puts it into action. And as at 2025, the 26 countries in the world have already adopted this recommendation. But when you look at it within the African continent, where this study was conducted, Zambia has implemented, but a lot of countries still haven't taken up. Also in Asia, India was part of this study, but also hasn't taken up this recommendation. So in Zambia, this was what was done to domesticate this. So once the WHO issued the guidance, there was a technical committee which was convened that reviewed the recommendations and look at whether it was feasible to implement this within the context of the national TB program. And once that decisions were made, then the policy framework developed and guidelines were updated, implementation tools were formulated, and then a phased rollout of this implementation starting with a few districts and then scaling up to more districts. And this has been accompanied by a program of monitoring this changing just based on experiences. And you'll see that it's involved so many players, upstream policymakers, different stakeholders, different experts, and downstream the healthcare providers themselves and this implementation was started with a revision of the guidelines and the policy framework, and then was then implemented in a few districts. And after lessons were learned, and it was scaled up to more districts. And as we are speaking now, there's a now push to have it adopted countrywide. So that's the first example of how research informs global policy, and then the global policy guides national policy. The second example I'll give you involves WHO making a recommendation on improving ways to find TB in children. This recommendation was a conditional, since WHO makes a conditional recommendation when there's upcoming evidence that suggests that an intervention may be beneficial. They don't have all the evidence that is needed. So they make what is called a conditional recommendation and then asks nations and researchers to generate more evidence to see how well this recommendation can be used and utilized. And so the WHO in 2022 made a recommendation that you can use treatment decision algorithms, which is just a tool that helps a healthcare provider identify a child with TB, given the challenges that I mentioned earlier on that are associated with identifying TB. And the Decide TB consortium responded to this. So the Decide TB is a consortium made up of researchers and national programs from Zambia and Mozambique. And so the intervention is designed to validate this recommendation from the WHO learned experiences made. So this took into account taking the recommendation of the use of the TDS and then integrating that with a recommendation in the shorter treatment to then provide tools that can be delivered on a digital platform at different health hospital level and at primary health care facilities in these two countries. Okay, so this intervention has two components: the research component and the implementation component. The implementation component is undertaken by the National TB Program and the researchers, the research component to inform the implementation. And if you see, I think Joanna already alluded to this earlier this week, it's quite a multidisciplinary team that is looking at the different aspects of this policy in terms of implementation, health policy, health economics, effectiveness, and social behavioral aspects of the intervention. So within this framework, we have the National TB Program that is guiding the policy, and the national TB programs are within countries that are key in making decisions about which policies should be implemented within the country. And they do so by reviewing all the evidence that is available for that. So within the framework of the Decide TB consortium, the Decide TB and the national TB programs, the ones that are being implementation, because it is being piloted within the framework of the national TB program. So they undertake the training, the supervision, and the monitoring aspect. And through this process, they gain first-hand knowledge on the use of the TDAs and the challenges that are the opportunities. And then the researchers within the team then process the data that is being generated through this implementation. And then they use this data to inform the national TB program on any ongoing improvements that can be made to the intervention and also to affect policy decisions. And then together, the NTPs and the researchers then engage other stakeholders, such as the Ministry of Health, international partners play a key role within TB implementation in the country, so that then we can get a buy-in and support for future adoption of this intervention. And at this point, this project is still ongoing, but already we have the national TB program, which is now in Zambia, which is now reviewing its strategic plan for TB, and it's already adopting some of these interventions into their strategic plan because they seem promising and they need to take them, step them out further. And so they're including the TDA-based approach as well as the costing from the CITB project to formulate the global fund concept. And within one of the products the CITB is to have training materials for the implementation of this approach. And so one of the expectation is that these training materials then from the research side be transitioned into the tools that can be used at national. And therefore, through this integration between the research of the national TB program, all that when the project fund ends, these things can then be easily, very seamlessly integrated into national practice. So what have we learned? So the key lessons we learned through this process is that rapid communication of our research findings is very helpful. And as you've seen, from the time the research is done to the time that guidelines are made to the time that it is implemented, it really takes several years because of the process that is involved. And having good guidance and practical and relevant framework support the national is very helpful. That you need to invest in the tools that are needed to translate the research into practice with clear guidance and tools and algorithms that can be used at different levels of care, and that engaging the key national players as you are doing your research and tagging them along, it helps in future adoption. And as in the case of the CITB, where we have the national TB program managers, Zambia was a big as part of the research project. That is also helpful because then they will go on, because then the experience from the project, so it will be easy for them to transition what they learned in the project into the national program. I think that's all we had to share with you. Thank you very much.
Okay, thank you, Chishala Chabala, for this interesting example of using research funding based on TB treatment to recommendation and program national. So let's now move to the third speaker for this session. So I don't know if he is here. Okay. So thank you, Mr. Habtemariam Kassa, right? For coming. So, Habtemariam Kassa is working at CIFOR-ICRAF, I think it's that. And he is a principal scientist at CIFOR-ICRAF based in Addis Ababa. And with over 20 years of research experience in Ethiopia, he works at the intersection of forestry policy and institutions. And his presentation, the title is Training CIFOR's Engagement and Informing Ethiopia's Forestry Sector from Research to Policy Reform. So, Mr. Habtemariam Kassa, to give your speech. So you are with me.
Good morning. Allow me to thank the organizers for inviting me to share our experience entirely in a different sector, which is forestry. But I thought the whole objective is how to really use research results to inform policy. I hope we'll have something to share as well. Thank you very much again. I will be talking about, sorry, it's a bit quicker, yeah. I think I want to share 20 years of research where we think we have reached somewhere. Unlike previous experiences where we do research and we don't really see the results. So my talk will be more on formulating the problems and then to talk about how change has happened, what has actually happened, and probably finally with a bit of conclusion in terms of lessons. As you could imagine, yeah, forests and trees are very much related to our lives, the environment, as well as to the climate. So they are very much linked to conserving biodiversity, helping us adapt to and mitigate climate change, contribute directly to food security and health, also to tree and forest-based products, development of value chains, and particularly also in terms of equity. With this, I think this is a global picture. Let me take you to Ethiopia. We did a forest cover assessment in 2023. You'll have a look at it. And based on the definition of forest that Ethiopia has adopted, it's not based on the definition of FAO, that the forest cover in Ethiopia is about 23%. It contributes roughly up to 30% of the GDP. Now, this is taking into account the contribution of youth, not the direct contribution to the economy. And in many areas where we have studied contribution of the forestry to communities around forests, it amounts to 21% of their passion. So when we talk about forestry, the tendency is to talk about their contribution to biodiversity, water, etc., but less about nutrition, income. So I think it is important that we recognize and build on their role for socioeconomics and livelihoods. At macro level, if you see millions and millions of people globally and also in Ethiopia depend on forests, but there is a huge deforestation going on in Ethiopia. It used to be over 90,000. Now recent reports say that it has scaled down to 20,000. But I will show you again, this has led to huge resource degradation, soil erosion, etc. I will show you clearly. So there is also a climate stress that's adding up to the complexity. So you will have deforestation that leads to degradation, then degradation to agricultural productivity decline, then to poverty. So the political system in Ethiopia is really facing a huge stress. Now, this is the map that we produced that the government has officially recognized and approved. The dark green is what you see as forest, again, based on the definition of the government of Ethiopia as forest. So you could see that much of the yellow is actually agriculture coming into the forest, and the light green is mainly grassland. As you could see, there is huge land use change going on and land use conflict as well, as because it's important to note that the country doesn't have national land use policy. Now, this is a common picture that you could see because we don't have a national land use policy and plan, and most of the laws are poorly implemented. Then you see deforestation coming up, cultivation of steep slope areas leading to deforestation, and all the consequences of this on water supply, agricultural productivity, etc. Now, I think I should come back. Yeah. Now, if you see this one, the dark brown area shows land that is very much degraded that requires preventive restoration. And as you could know, that Ethiopia is a very mountainous country, and this is coupled with slope. It actually increases susceptibility to further degradation. Overall, over 50 million acres of land in Ethiopia is degraded, and it requires landscape restoration. As you could see it. Now, much of the most degraded area is also where we have the most food insecure regions. So food insecurity overlaps with land degradation, so the need for resource restoration. So as you could see, now, if you could also bring in poverty now, and other social challenges, they are very much associated with the resources we have. Now, people are realizing that it's not only the challenge of food, but also wood is becoming scarce. As a result, projected volume of wood imports is increasing over time. Now, not only wood import, but if you see the trade of wood products, I think it's very negative and it's expanding very, very high. So you could really see that Ethiopia is not only food deficit, but also wood deficit at national level. Now, this has been taken up by the government, and as you could see that the nation is engaged in massive tree plantation. I think the rationale behind is to really address the food security as well as the wood gap in the country. Now, despite all that, what are really the sectoral challenges? Now, the core issue has to do with weak forestry institutions. The education, the research, the development wings are weak as well as fragmented, and very often put under the Ministry of Agriculture or other institutions. We have also land and forest laws that are really poorly designed. They are not really informed with science and evidence. And whenever we have laws, then they are also hardly implemented. So, in the law, what we wanted to bring about a change is also on the rights of communities on the use of forests. And these are not recognized by law. The other aspect with regard to the forestry sector is also the training that the foresters have gone through. So most of the foresters are trained to protect forests rather than promote sustainable use. So the training failed to really help the sector. So we realized that we should do something on the education level. So the education is theoretical and very much focused on conservation-based forestry. Research in forestry is also very much, detached from reality. And there was little actual research going on. More importantly, forestry was dependent on donor-funded projects. So when we have this large area of land being degraded, the government should have created a means to generate domestic resources to combat deforestation and support farmers to plant conflict. So, as you could see, we needed to tackle education, research, policy, finance. This was how we tried to approach the issue. So I'm telling you, this is a 20 years of job. It's not really a short time engagement. So we were engaged. So when we were engaged, then we thought we should first start with the education system. So we started our engagement with Lagana College of Forestry to help them craft courses that are problem solving, to adapt actual research in their research protocol. So more or less what we were playing was a role of connector and facilitator between education, research, policy, and finance again. Now, you could see some of the evidence-based things that we generate. We organize series of trainings, workshops, and some of the laws that are issued. We contributed, by organizing workshops during the write-up of those legal documents. Now, then we said, okay, let the independent, assessment unit within CIFOR evaluate what we have been doing over the last 20 years. So they used a theory-based contribution analysis, and that's how they framed our contribution. So the step-by-step transformation pathway was a central message, and actually I'm sharing the result of an independent evaluation by Center for International Forestry Research, the quality assessment. So this is the theoretical framework they used in the evaluation. They were here talking to partners, talking to institutional leaders, etc. So if you are interested, in terms of the detail, you could go to the CIFOR website and you could see that brief that has the details. Now, one way to bring about a change was to really build the capacity of individuals as well as institutions. So we worked through the education system, as I told you, to craft programs. One was on natural resource economics and policy. The other one was on dry forest management, because the training was on conservation, high carbon, biodiverse rich forests, whereas much of the forests are dry forests in Ethiopia. So we also assisted and supported graduate students to do research on selected topics that we thought were missing in the whole curriculum. We worked with the research institutions to integrate development-oriented interdisciplinary research. We are trying to be specialists in our education system. I want to go back. And we become specialists without being generalists. So we really value, the whole, point of working as a team. So I think it wasn't an easy exercise, because everyone thinks that their profession is much superior, adequate enough for this problem. When in reality, that's not at all true. So integrating this actual research in the education system wasn't an easy exercise, but I think we tried some. We also worked with policymakers to show them that there were policy gaps as well as legal gaps that need to be addressed. So this continuous engagement, first, we ended up in convincing the government that the FAO definition is not really good for Ethiopia. So Ethiopia should adapt its own definition so that it could benefit better from the international cargo. So they adopted it in 2016. There were proclamations issued, the forest law in 2018. It, for the first time, recognized community rights on forests. There were also regulations. Another proclamation in 2024 is where the government has allocated 0.5 to 1% of the federal government revenue for landscape restoration. I'll come back to that. So community forest rights have now been recognized in the law, and carbon revenue sharing was recognized only in 2024. Now, much of the carbon from natural forests that communities are involved in protecting up to 80% of the remaining gold. So I think that is an interesting element probably to learn. So research results and continued engagement. And I will come back to that. I think this engagement also requires a kind of, an informal, low-level discussion with policymakers, not really, telling them what to do. The financing gap, as I told you, is a major one. This is the first, probably many countries don't have that. So I think this credit goes to the government now. So we are yet to see its implementation. It's really a breakthrough. So at least now you see that the government has decided to allocate X percentage for landscape restoration, not because they realize that the landscape degradation is going to cost them even more if they don't act now. So we are now somehow seeing that we are crossing the loop in research through capacity building, through legal and policy changes to addressing the financial gap. But I think we should also admit that there are remaining challenges, risks. One is this continuous institutional stability. After elections, the government reorganizes itself. And very often we hardly know, the rationale as to how one ministry is, split into two, or two ministries are merged into one. And this actually results in frequent staff turnover. So specifically in Ethiopia, forestry has been restructured over 30 times in the last 50 years. 30 times. You can't keep good people. Yeah? You lose institutional memory. So the risk is still there. The capacity of institutions is still limited, especially at the operational level. The education system has expanded, so you get really highly qualified people at the federal and regional level. But when you go down to the more operational level, the quality and capacity of people is also limited, but also the resource allocation to the sector is also low. The other very important element is also, even if you change laws, communities need to have the agency and the capacity to demand their right. So even if you have it in the law, if the community don't demand their rights, the tendency is that they might not get it. So we see that more often. So gains are not really guaranteed. So I think efforts need to continue monitoring and support. What is really the key lesson, the final message? The first thing is you need to build trust with the government. We need to respect government. The tendency is the government people think that we, the educated ones or intellectuals, undermine. So make sure that they know that you respect them. That helps you to build the trust and also generate data, objective data. You can't go and convince a policymaker based on opinion. You should do your homework, so you should really have the evidence. If you don't have evidence, don't even try. Then they will see you as a trusted source of information and knowledge. The other one is the support should be embedded. You should be part of them. An informal one, a low-level, continuous engagement. So they see you as part of them. And as you formulate your messages, formulate it in a way they want to listen. It's not in the way that you want to tell them. So you need to formulate the message. Like, what type of message? They are not interested in forestry's role for carbon, whatever. Probably tell them, well, if you sell carbon, you get money. Yeah? If you develop forests, you create employment. If you develop forests, you reduce your import, so you don't need much dollar. Tell them in the language they want to hear. Then, as I said, quiet diplomacy helps. I think let them take the credit. Don't show yourself in front of them. Don't try to be seen as if you are evaluating them. So give them all the information so that they will take, at times, they will take they will claim that they have done it. Keep quiet. your objective is not to be recognized. Your objective is to see things are changing on the ground. So research, trust, policy, finance helped us to somehow make a bit of transformation in the Ethiopian forestry sector. I would conclude by saying that research can drive real change when combined with trust, long-term and evidence-based engagement and capacity building also. You need to build the capacity really. So you don't assume that there is a capacity. This capacity building is also sometimes hiring and you build capacity, people go, but continue as you can do. So success is not only technical, but it is also relational. So I think with this, I would like to thank all donors, but also our national partners who gave us the ears to listen to us. Thank you very much.
Thank you, Mr. Habtemariam Kassa, for this insightful example based on strong partnership between CIFOR and the Ethiopian government in order to improve the forestry sector for policy program and plans. So I think that now we move to the Q&A session. So we are, I think, 20 minutes for the question if you have. So we can take 4 and 5 questions because we have 20 minutes again before uploading this session. Okay, is there a second mic? So, sure. Okay, so let's use this mic.
Thank you very much. This is a very important topic. We researchers are relatively much better at doing the research. But when it comes to communicating it to policymakers and bringing about change, that's very tough, and it's very interesting to hear some positive stories about this. Having said that, I will quickly forward some questions to all the three presenters quickly. So I hope Gashaw is also there. So for Gashaw, he's not there? So I don't ask, right? Okay. So my question to Gashaw is, it's an interesting study that is being planned, but the idea, looking at the objectives and also the outcomes, the expected outcomes of the study, is to bring about some impact, right? You want to give training, do other things, and then you want to see the impacts. My question there is, as we have seen, in a number of cases, it takes quite some time, right? Like the last presentation, Dr. Habtemariam was talking about maybe 2 decades or so. So with this kind of study, what is the time, the period to see the impact? That is one question. The other question is, as part of the study, you want to provide training. And I think that is also important because we believe training is important, but the content of the training is also quite important. What exactly are you going to provide is key. And another related question is the issue of contamination. You have 3 groups. Is there a guarantee that they will not talk to each other? On the presentation on health, Dr. Chabala, you, particularly the first part, so where you looked at the effect of reducing the treatment period for TB, Could you tell us a bit more about it? Because from what you said, unless I missed it, the study was conducted in Zambia and probably India as well. I wonder if there are other countries, because if it is based on those studies and then that led to a change in guidelines by the WHO, which applies to the whole world, how reliable was the study? I think it would be good if you tell us about that. And my last question to Dr. Habtemariam. It is a very interesting presentation. It's also an area I've been working on, and it's interesting to see such impacts. One issue that I would like to forward is the issue of claiming also, like who has contributed to those changes. I know you've told us that you didn't want to show it, but to say that we did this and because of this has happened, particularly in this kind of context, may be difficult because there are different actors who contribute to that. So just a comment on that. Thank you very much.
Okay, first after you, I think Professor Veronique wants also to ask questions to the speaker.
Merci, merci aux trois intervenants. Alors, c'est le mien. Merci. Alors, j'ai deux questions. Ma première question concerne les trois intervenants. Alors, nous sommes tous conscients qu'aujourd'hui, les défis qui guident la recherche au sein des universités et des centres de recherche, c'est des défis sont connus par nos politiques, par nos responsables politiques. Donc, ce n'est pas qu'ils ne savent pas, ils le savent. Maintenant, moi, la question que je pose, parce que normalement, pour tous les trois intervenants, je ne sais pas à quel stade de leurs études ils ont impliqué réellement les politiques. Parce que pour moi, ce que je n'ai pas entendu, dès qu'on a une question de recherche qui doit apporter une solution, qui était un problème, je pense, de rester pays. Bon, normalement, tous ces problèmes, ça n'a pas de frontières, c'est mondial. Normalement, dès qu'on commence à réfléchir, à poser déjà la question scientifique, à commencer à réfléchir, à avoir les objectifs et les impacts que nous voulons avoir, on doit associer les politiques. Moi, dès le départ, c'est vrai qu'on est des scientifiques, mais les politiques aussi peuvent guider nos choix dans nos objectifs et nous guider même dans la conduite même de cette recherche. Alors, à quel niveau vous avez, vous, impliqué les politiques? Ma deuxième question, c'est pour celui qui a fait la présentation sur la tuberculose. Bon, c'est une question naïve. Normalement, je sais que dans nos pays africains, l'État subventionne le vaccin de la tuberculose au niveau des enfants, je crois une semaine après la naissance. Et je me rends compte qu'il y a quand même pas mal d'enfants qui ont la tuberculose. Je me pose la question, quel est l'intérêt de ce vaccin? Ce vaccin agit jusqu'à... Quel est son impact, en fait, sur l'évolution de cette maladie au niveau des enfants? Merci.
We need to take one more questions. Okay.
Oui, merci. Je voudrais féliciter tous les trois orateurs ce matin. Aussi, j'ai une question pour le professeur Chabala en ce qui concerne l'étude sur la tuberculose et ses chaînes. Je m'associe à toutes les questions qui ont déjà été posées dans ce sens. J'ai une préoccupation cependant pour aboutir à de telles recommandations qui ferait office de directive nationale est généralisable, il faudrait que ce soit dans un essai randomisé, double aveugle, avec tout ce que la science exige à ce niveau-là. Parce qu'on sait que la tuberculose reste encore un problème de santé publique majeur et passer une réduction de la durée du traitement de 6 mois minimum à 4, et en plus dans une population, je vais dire fragile, qui est celle des enfants, étant donné que la plupart des enfants qui feraient la tuberculose sont ceux qui auraient échappé peut-être au BCG à la naissance. Alors, pour arriver à un tel niveau, c'est vrai, ça paraît révolutionnaire à première vue, mais également un peu dangereux si on prend la mauvaise route. Est-ce que vous proposez un protocole de traitement, un schéma thérapeutique plus renforcé pour pouvoir donner un tel résultat? Et puis, dans le contexte zambien, est-ce qu'il a été suffisamment évalué? Comment la stratégie que vous proposez pour pouvoir permettre un passage à échelle? Et si c'est le cas, ben, vous aurez peut-être décroché un prix Nobel, peut-être. Alors, voilà, c'était juste une question.
Thank you. My question is to Habtemariam. It was a very nice presentation, the journey you experienced. But probably the forest area is a bit neutral. But working in other public policy domains, it could be very difficult sometimes to agree with government officials. And also the role of researchers, think tanks, is at times to contradict or to trigger a new policy change, probably not to the like of the government. So how your approach may work or may not work in other contexts, I would like to have your view. And also from your experience the last 20 years, were there times you had difficulties, conflicts, because there is also turnover of government officials, as you have said, the forest the department was changed, you said, for several times, right? So how were you able to manage such kinds of conflicts or tensions?
Yeah, many questions on this issue, but so we'll take 2 more questions and then we'll let the speaker have time to give answers to those questions. So can go.
Thank you for your little presentation. My questions targeted to Habtemariam. My first question is, how do you position the role of settlements related inefficient land consumption, with particularly related with urban sprawl and settlement development? How do you position in increasing land degradation, food insecurity, poverty, and what strategies do you think are feasible in reducing its impact? And my second question is, as you say, speaking is a language the stakeholders understand is important in having positive impact. What strategies did you find to be effective in having positive influence in bringing policy related or research-based policy impact? The first one, how do you position the role maybe inefficient land consumption related with settlement expansion, like urban sprawl and fragmented villageization? So, thank you.
Merci, je vous remercie pour vos présentations. Si j'ai bien compris, la première présentation, le monsieur est parti. J'avais juste une question concernant la typologie des policymakers qu'ils faisaient. Ils sont très différents en réalité. Et donc, je voulais juste comprendre de quoi ils parlaient, en fait, dans cette généralité policymaker. Ils sont tous très différents, avec des intérêts différents, etc. Ensuite, j'ai une question pour docteur Chabala et Johanna, Daniel, pour le travail mené dans le cadre de la lutte contre la tuberculose. Alors, c'est assez intéressant parce que la tuberculose fait partie des problèmes les plus stabilisés. C'est-à-dire, c'est un problème qui est là, dont on n'a même pas besoin d'en faire de portage. Donc, c'est pas, il n'a pas besoin d'un processus ou de configuration d'acteurs pour le porter, pour en faire la promotion. Et ma question est la suivante. Qu'est-ce qui se passe quand il s'agit d'une pathologie qui n'a pas de promoteur, et qui en réalité n'intègre pas du tout les agents, parce qu'elle n'est pas intéressée. Il n'y a pas d'intérêt pour les décideurs publics. Je pense notamment au diabète de type 2 qui a pris 20 ans à s'inscrire dans les agendas, par exemple au Mali et dans certains pays, parce que les représentations de cette pathologie ne coïncidaient pas du tout avec celles des représentations des décideurs publics. Et en fait, c'est une question de fenêtre d'opportunité qu'on rate et qu'on peut rater également. Ce qui me ramène à la troisième question qui s'adresse à vous, monsieur. Vous avez dit qu'il faudrait s'adresser avec des évidences aux décideurs publics pour qu'ils nous comprennent, pour le convaincre. Mais ces évidences-là, si elles ne coïncident pas avec ses propres intérêts, n'ont absolument pas d'intérêt en réalité. Donc je demande, est-ce que également il ne faudrait pas s'approcher de ces parties prenantes, de ces décideurs publics, d'abord avec des choses qui peuvent. Enfin, connaître déjà leurs intérêts. C'est quoi leurs intérêts? Parce que leurs intérêts changent énormément, les configurations des acteurs changent. Et si on ne maîtrise pas véritablement cette dimension-là, je pense que le travail. La seule manière d'avoir une fenêtre d'opportunité très claire, c'est quand il y a des problèmes, ce qu'on appelle les problèmes spontanés, comme le séisme, quelque chose de spontané, naturel, un problème naturel. Là, les décideurs publics se tournent spontanément vers les chercheurs, vers les Covid. Et en dehors de cela, en fait, il faut toujours une fenêtre d'opportunité. Donc, un problème de santé, hein, c'est d'abord un problème public. Donc, donc je voulais.
It's okay, is it right? Okay, so Professor Dosi, and then yes,
Question.
the last question. And
Merci.
so, please.
Merci pour votre générosité. J'ai juste une observation un peu d'ordre général. Nous intervenons, moi, mes trois communications posent de différentes manières la relation entre la recherche, l'expertise et l'action politique. Et je pense que même parfois qu'on retrouve l'expertise et la recherche confondues, on n'est pas sur les mêmes pratiques, sur les mêmes postulats et les mêmes exigences, etc. Mais ce n'est pas de ce problème que je veux parler. Je parle juste la manière dont la recherche va vers l'action, qui devient recherche-action, et pose de façon très forte le problème, comme d'ailleurs pour l'IA, le problème des énoncés, d'abord de la construction du problème lui-même, et donc du problème, et le problème de l'indépendance et de l'autonomie de la recherche dans l'action publique. Devant tout ça, la manière de monter les énoncés, actuellement, et ça je le vois dans la pratique d'universitaires ou de chercheurs, dépend beaucoup du financement. Il n'y a plus de recherche spontanée, blanche, c'est-à-dire fondamentale, déliée des agendas politiques. Et donc, il comprend bien que la recherche doit servir à l'action. C'est bien. Mais en même temps, il y a une exigence importante qui est de préserver l'autonomie et l'indépendance de la recherche par rapport à ses objectifs. Mais parce que dans les évaluations de notre travail de chercheur, on nous pose toujours cet impératif de l'efficience, de l'efficacité, comme d'ailleurs pour l'université. On nous oppose l'employabilité de nos compétences. Et on nous oppose pour la recherche aussi son efficacité par rapport à l'action politique. Ce qui est un facteur d'efficience, mais ce n'est pas le facteur d'efficience, parce que la découverte, l'innovation, la critique, la déconstruction des habitudes est aussi une exigence, un impératif de la recherche.
Thank you, Professor Tony. I think we just less than 10 minutes, so let the speaker answer some questions, and after we can continue discussion during the coffee break, please.
So I'll try and address some of the questions that were directed at me first. So there was a question about whether this study the treatment shortening study, where it was done and whether it can be applied everywhere. So the study was conducted in Zambia, in Uganda, in South Africa, and in India. And this study was a clinical trial. If you're familiar in healthcare, clinical trials are kind of considered at the apex of medical evidence, in that people are randomized to an intervention, therefore it does minimize lots of biases. And then it's a large clinical trial, 1,200 children. So it's the largest ever conducted clinical trial on tuberculosis treatment in children. And therefore, I think that its findings are quite reliable. But obviously, clinical trials are conducted in a controlled, and therefore, when you are now moving to routine clinical practice, you have to contextualize a lot of things to take into account the difference between the clinical trial setting and the routine setting. There was a question about the TB vaccine. So there was a question about BCG, which is given to children at birth and for the protection against TB. So BCG protects children against developing severe forms of TB. It doesn't protect them against all forms of TB. And a perfect example I can give you, for example, is the COVID vaccine. COVID vaccine, when you get COVID vaccine, you can still get COVID. But the difference between somebody who didn't receive COVID vaccine and somebody who received vaccine is that one who hasn't had a COVID vaccine will end up in ICU and looking mechanical ventilation, while the one who has received COVID vaccine will have immune disease. So it's the same concept with BCG. It protects children against severe forms of TB, but it doesn't protect them against all forms of TB. Then there was a question about whether this shortening treatment is a bad thing. I think that more and more TB is moving to stratified treatment, in the sense that because the disease spectrum is different, therefore you can't treat everybody the same. And moving to stratify disease according to severity. Then you treat appropriately based on severity. So for this trial applied to non-severe form of TB, and therefore we can say 4 months is adequate, but it doesn't apply to severe form. Then it's the same example, for example, in cancer treatment, you can have the same type of cancer, but you are staged according to the stage of cancer, and your treatment is then provided according to the level of the stage of cancer that you have. It's the same concept that is being applied to TB treatment. There's a question on whether TB is a problem. Yes, it is. 10 million people in the world develop TB everywhere. It is still the largest infectious disease. It was only displaced by COVID for 2 or 3 years, but it's the leading cause of death due to an infectious disease. So it is a problem, and it also affects people with comorbidities, diabetes, heart disease, worsens those diseases, individual who can TB and have other comorbidities. I think I'll pass to my colleague, and then I can address others that I may not have touched.
Thank you very much. I think Professor Alamu raised a very important question on the whole issue of contribution. This was what our institution wanted to be said, and this was what we kind of resisted, because we can't really play. We contribute. So I think from that policy brief, what you will see is that without our contribution, probably the achievement would have been less. That is what we could say. But we can't really claim policy reforms as a direct contribution. We contribute to by raising the need for changes, by helping them articulate key issues, providing evidences to that end. So when it comes to attribution, it is a tricky area. Our conclusion was, without the research and evidence support, probably some of the changes that were made could have been made by the government itself, but wouldn't have been in that from before. That's what we could say. At which stage do you engage policymakers? Very, very important question. Frankly speaking, in what has helped us initially was to work with the education system. And some of the students that we helped are now some of the policymakers. And there is a time factor, but that also facilitated engagement. But when it comes to policymakers, I think what we did was, as a research institute, we are also donor dependent. So we have topics that are largely driven by donors. But each time we do projects, we invite policymakers and say, here is a project, what are other issues you want us to also look at? So right from the very beginning, they feel that they are dictating our research agenda. In terms of engaging policymakers, I think you need to be opportunistic also. Watch out what the government is doing. If they are going to change law, just be on board, try to help us. So I think it's also being opportunistic, knowing what they are doing, and try to capitalize in terms of what you can offer to help them better achieve. Regarding other sectors, you're right, forestry is a less political sector, I know. That's much less confrontational than, for example, food security or health, etc., where change is really difficult. I'm sure that there are efforts being made, but I think forestry being less amenable to changes and even politicians, I think probably bringing about the change in the forestry sector would have been probably much easier than other sectors. I also agree. But frankly speaking, also, it doesn't mean that policymakers take all of your recommendations. There are areas where we can't really say in public, where we totally disagree on what they do. We tell them and we stop. We don't declare it in public. We don't write in newsletters. We just keep quiet. It's not once frequently. There are areas where we totally disagree, even in the forestry sector. In terms of land use, with regard to urbanization, probably I might not be able to share specific recommendations, but I would hope that this would be part of the bigger land use policy and plan that the country needs to address. We have been requesting the government, encouraging the government to have a clear land use policy and plan at a national level, but we don't have it as such. Let's hope that they will pick it up. Some of the regions are having their own land use policy and plan, actually. Land use plan. The other one, if I remember, yeah. In terms of independence, I think that's very, very important. There are cases where we were invited to do an assessment of a specific initiative, where our findings were very, very different from what the government says. So we agreed to disagree. So we agreed not to publish those results, and they agreed not to tamper our research findings. So as a researcher, you need to keep that independence. Yeah? I mean, the independence is there. So research objectivity needs to be made, I think. If I haven't responded to, is there anything missing, Chair?
I think it's okay. That's it. Okay, so just give 5 seconds to Thierry wants to answer the question as to Gashaw, right? 5 seconds, please.
So, my name is Gashaw Abate. And I'm going to enter his protocol. I think so. This was questioned by Professor Alemo. On the time frame, it is relatively short term. That's the reason why they're going to measure attitudinal and knowledge intermediary outcomes. Given that there's not going to be any policy change during the course of the experiment, which is I think over a few. The cohort are trained over 6 to 12 months, I think. Now, in the long run, they want to follow up on these people, but of course, there will be contamination across those experimental groups. So, of course, this will be diluted. It will be much less. I mean, you can put some lower bounds. Just to say a word, what was interesting, and I want to say a word about this session, is the study by Gashaw Abate and brother is reminding us that this is a research topic in and of itself, probably one of the most important. It is fascinating to see how across different sectors, different contexts, different institutional and scientific organization, things go in different directions. And so we're building this in IPORA. This session is helping a lot. We need to bring data, of course. And so thanks for helping us think about that.
Thank you, Thierry, and thanks to our distinguished speaker for today, for the session today. So before having our coffee break, let's have some key takeaways, only 3 key takeaways. So the first is relevant research finding that address policymakers' demand. That is one thing that's important. The second thing is to work closely with international partner, national partner, NGOs. And in this collaboration, we do have diplomacy language. And the last thing is to encourage countries to based on research programs. Thank you for this session, for attending this session, and then let's have now a good break. Thank you.